Hi everyone, I am Dr. Suleyman from KOLAN International Hospital and bone marrow transplanter and hematologist. We have good hospital and A+ hospital in Istanbul. In bone marrow transplant unit, every time need A+ hospital. A+ hospital is A+ hospital necessary in all clinic situation, all laboratory examination needed. Who need for the transplantation in Turkey indication? Patient with a diagnosis of the acute and chronic leukemia, lymphoma, multiple myeloma, some solid tumor or cancer, aplastic anemia, myelodysplastic syndrome, and thalassemia, and some other metabolic disorders, other treatment refractory diseases. During the bone marrow transplantation, all the bone marrow transplant patient necessary evaluated and full lab and body examination. And also allogeneic transplantation needed HLA examination. If it is suitable for the transplantation and all this situation, patient is informed about the procedure to be performed and chose for the transplant patients. In our hospital, bone marrow transplant unit is do all transplantation procedure, generally for Turkish citizen and foreign national. And besides the transplant success rate, we are, and 97% is big answer for yours, is success rate is very good for us and for the world. How can I get the stem cell and which one source do we use it? And stem cell collection, and how do I get the stem cell? And firstly, in autologous and allogenic and syngeneic from the brother and sister, and unrelated and mismatch and haploidentical transplantation, and sometimes refractory patients needed CAR T-cell treatment. And the experimental side, and sometimes we use it stem cell engineering for mesenchymal stem cell transplantation and dendritic cell transplantation, mostly for the GVHD, mostly GVHD, graft versus host disease procedure. Which one do we use this source for the stem cell? 100% and bone marrow, directly collecting bone marrow, and mostly we use the peripheral blood cell. And from the bone marrow bank, cord blood, and from the lab, embryonic stem cell, and fetal liver and fetal bone marrow, all of these experimental situation for the laboratory. This is hematopoietic stem cell chart and cascade for the primary stem cell and after ended neutrophil, thrombocyte, and erythrocyte. You know this mostly. I know that the stem cell is transform the somatic stem cell. For example, for the somatic stem cell and dermatologic stem cell and enterocyte, and fatty cell, and chondrocyte, endothelial cell, neuronal cell, mastocyte, and liver cell, etc. We know this. Stem cell transform all somatic cell. Perfect stem cell, we use mostly perfect stem cell for bone marrow. Normally, it's in bone marrow side, stem cell is 101% for the bone marrow, and perfect stem cell 1001 perfect stem cell. We have it all this body. For the autologous stem cell collection, and we needed mobilization. For the mobilization, we use this chemotherapy cytokine in autologous transplantation patients. After mobilization time, approximately 10 and 15 days, collecting perfect stem cell, collecting for perfect stem cell by the leukapheresis and apheresis machine. This is apheresis machine and set and apheresis bed. This area is apheresis area. Bone marrow transplantation, mostly autologous, allogeneic, the subtype, myeloablative, non-myeloablative, and unrelated, we say that. And you know this, many internet sites comment this experimental stem cell transplantation. And maybe next time, next 20 and 10 years after, maybe spare part, use it. In allogeneic transplantation, for example, firstly, we will start TBI or some chemo, approximately 3 days, 10 days, sometimes 15 days, and started -10, -7, etc., like this table. 0 day is transplanted day. For the allogeneic transplantation, we, on the other side, we will prepare some donor, brother and sister, and other donor, allogenic and unrelated donor. We needed to prepare for the stem cell. Autologous transplant, and if the patient needed chemo and started chemo and cytokine, sometimes in the remission for the autologous transplantation, only we use cytokine. This table is chemo plus cytokine, and approximately chemo and cytokine after 15 days we collect, and after the only one cytokine, if I use this, after 5 days we collect stem cell. In summary, hematopoietic stem cell transplantation clinical indication. Hematologic diseases, all malignant and some benign hematologic diseases. And myeloproliferative patients, acute leukemia, chronic leukemia, many patients for the hematologic diseases, if it is malignant side. And solid tumor, mostly we use solid tumor, and some refractory patients needed CAR T-cell treatment, some childhood solid tumor. You know this congenital immune deficiency status situation, and some metabolic diseases like Gaucher diseases, mostly major hemoglobinopathy, and some autoimmune diseases, for example, systemic lupus erythematosus and some antiphospholipid syndrome for the treatment refractory to the treatment for autoimmune diseases, and these experimental ones, maybe every time change this situation, and some neurologic diseases, some other diseases. This is a very good situation. Sometimes we collected apheresis product for the autologous transplantation, sometimes allogeneic transplantation. Some special site, this area is collecting stem cell and storage. We send the storage area. In the storage area, in you know this stem cell 4 centigrade is 72 hours storage, only 72. But in the liquid nitrogen, it's endless. In this area is liquid nitrogen area. Cell engineering, all experimental area for the stem cell. Sometimes some people use this ischemic heart diseases, some refractory patient is peripheral vascular diseases, some neurologic diseases. You know that this area all now experimental. And oncologic disease as well, some treatment restriction we have, but more vaccine and CAR T-cell treatment, now we use this, some refractory oncologic patients. Maybe you know, maybe next time in 10 years, after 10 years, 20 years, I don't know now, but it's very quick procedure and very quickly follow it. And stem cell and the spare part, you know this, is 1980 is bone marrow transplantation, say experimental, but is now classical treatment. Maybe after 10 years, stem cell is make spare part. Okay? Thank you for joining us. If any question, please ask the center and email, etc. Thank you.